All right.
All right, next slide, please. Great. So we have a lot to talk about. So our agenda for tonight. First of all, I'm Sarah. I am on the public affairs team at Planned Parenthood of Central and Western New York. So what can we expect from tonight's event? First, we're going to go over our learning objectives, our community agreements, so we know what we're going to be talking about and how we can create an affirming space together tonight. Then we're going to be level setting the current federal landscape and looking at the impacts state by state. Next, we're going to talk about some health considerations to think about before going off to college or while you're on campus. And then finally, ways to get involved in advocacy in your new state. Then we'll share resources for you to check out so you can make a plan for attending college in an abortion-restricted state, and we'll have plenty of time for questions. So that's the agenda. We can move on to the next slide. So what are our learning objectives? By the end of this event, we want you to have the information and the resources you need to create a plan for yourself or to help out another person, a friend or family member who will be attending college in an abortion-restricted state. We want you to understand the current breakdown of abortion restrictions throughout the country and how that impacts people on the ground state by state. And we want you to have some clear next steps on how to get involved in the advocacy work or volunteer efforts in your new campus community. Next slide. So community agreements, these are going to help us have a respectful, affirming space for everybody during tonight's program. So we definitely want you to participate, to join in, but we just ask that you keep yourself muted so that we can avoid any disruptions. But definitely utilize the chat to share your thoughts, ask questions. We will address all of our questions at the end of the night. And if we can't get to all of them, we will follow up in an email with anything we missed. We ask that you be open and listen to each other, speak from the I, sharing your own experiences. Respect all identities and pronouns. Again, if you want to share your pronouns in your name on Zoom or in the chat, that would be great. What's said here stays here, what's learned here leaves here. So we want you to take the information you learned today out into the community with you, out into the world. But if anybody is, sharing a personal story or experience in the chat, we ask that you keep that here within our space tonight. But also keep in mind that we are recording. Finally, if you have any concerns or technical issues come up throughout the night, you can send a direct message in the chat to Tyler, who is helping us out tonight. I think that's it. Sound good? All right, cool beans. And I'll hand it off to Maddie.
Okay, thank you so much, Sarah. I am Maddie Donovan. I am also part of the public affairs team at Planned Parenthood of Central and Western New York. Thank you so much for joining us this evening. I'm going to provide a brief overview of the national landscape and then review where restrictions stand on a state-by-state basis. So to begin, I'm going to quickly jump back to 1973, Roe v. Wade. This is one of the most well-known Supreme Court cases that protected the right to abortion in all 50 states, making abortion services safer and more accessible throughout the country. And this decision also set the legal precedent that affected dozens of subsequent Supreme Court cases until this past summer with Dobbs v. Jackson Women's Health Organization, that case and that decision that overturned nearly 50 years of precedent. And it also eliminated the federal constitutional protection for abortion. So it stripped people of the right to control their own bodies. At the time, abortion opponents said right out loud that their ultimate goal is to pass a national 6-week abortion ban that would make abortion virtually inaccessible in every state in the country. And as you are likely aware, on September 13th, a federal abortion ban was introduced at the federal level. It would ban abortion at 15 weeks nationwide. And while this bill is not expected to receive a vote in either chamber of the current Congress, that's the House or the Senate, it's a clear demonstration of what's at stake for abortion rights. And this ban is part of an extreme agenda playing out across the country as states are actively implementing their own abortion bans and seeking new ways to limit care, including ways to limit the right of their citizens to travel out of state for care. And as a federal ban, this legislation would override state regulation of abortion. So it would override access in states that are currently providing these essential services. So again, this bill is not expected to receive a vote, but it's a clear indication of what's at stake here. And bans like this one are already the reality for way too many states. And if you're here, I think you'll agree that all people deserve the freedom and bodily autonomy. They deserve the right to make decisions for their own bodies and their own futures, and that includes access to abortion care. So if you could go to the next slide. Hostile state legislatures across the country have rushed to make abortion illegal or inaccessible following this Supreme Court decision, which overturned Roe v. Wade. And for people seeking abortion care, this rush is causing widespread confusion and fear as the status of legal abortion is regularly changing across the country. So this map is the most recently updated map from Planned Parenthood. And looking at this map, you will see that the states that are shaded Black have made abortion illegal or completely inaccessible since the Dobbs v. Jehu decision was released. And so as you can see, essential care is no longer accessible in Idaho, Arizona, Texas, Oklahoma, South Dakota, Missouri, Arkansas, Louisiana, Mississippi, Alabama, Tennessee, Kentucky, and West Virginia. That is a huge portion of the country. The lightest pink areas show where the right to abortion is protected by state statutes or state constitutions, like Maine and Massachusetts, and also where access has been expanded beyond that, meaning other laws and policies have created additional access to abortion care. So for example, in New York, our legislature here enacted a comprehensive Abortion Rights Act through the Reproductive Health Act in 2019. And this year, after the Supreme Court decision, the New York State Legislature also enacted additional legislation to protect abortion providers and those working within the abortion ecosystem from being charged with providing abortion care to out-of-state patients. So this light pink also encompasses states like New Hampshire, New Mexico, Virginia, and also Puerto Rico, where abortion is accessible, but without legal protections. And that means it is still legal in this area, but it's not protected by state statutes or by state constitutions, like other portions of the country. And as the states get darker, the darker the states get, the more hostile those states become to abortion access. And another way of saying that is the darker the color of the state, the more abortion restrictions they have in place. So if we look at Pennsylvania, we will find that insurance offered through the state healthcare exchange that was established under the Affordable Care Act, or Obamacare, restricts coverage of abortion. State Medicare funding of abortion services is prohibited outside of narrow exceptions, such as cases of endangerment, life endangerment, rape, or incest. And also in the state, parental consent is required. So a parent or parents must give permission, usually written permission, for a minor to have an abortion. And while judicial bypass is available, this can be time consuming for people to obtain. And in addition to all of these restrictions, a patient must also wait 24 hours between receiving state mandated abortion counseling and obtaining an abortion in Pennsylvania. So then if we move over to a state like Ohio, we see additional restrictions. So in addition to the restrictions that I mentioned for Pennsylvania, abortion is also banned on or around 6 weeks in Ohio. And depending on the circumstances, there may be certain limited exceptions. So as you can see, the darker the states get, the more difficult it becomes to access these essential services in those areas. And while this is the current landscape, it's also important to note that these things are changing rapidly. So what's accurate now may not be that way in the coming months or even the coming weeks. And at the end, we'll share a link to this map and other resources that will enable you to stay up to date on the changing maps through our Action Fund and through our Federation, and also through the Center of Reproductive Rights. But I just wanted to pause and ask if there are any states right now that anyone has any questions about. Okay, and that is absolutely okay.
I'm sorry. I'm sorry. It's Teresa. What about, did you say something about DC? I heard Puerto Rico, and what about the other territories that we have?
Let me see about DC.
Because like, I don't know my geography that great, but right by Virginia, there's like a little pink something. Is that DC there? Next to Virginia?
You know what? I don't think it is. That is a really good question. Let me actually bring up the map for the Center for Reproductive Rights. I believe they have a more detailed map. And also, Sarah or Madison, if you know the answer to this right offhand, feel free to jump in as I bring up this map.
I'm not sure offhand, but if you're not able to find it right this minute, we can definitely follow up with some more information.
Excellent. Yeah, why don't we do that? And if we have time at the end, we can share the map from the Center for Reproductive Rights, which I do believe has DC on it. So
thanks.
Thank you so much for that question. Okay.
I know in the chat, sorry, Rachel also asked about Ohio in the chat function.
Okay, yeah, so in Ohio, we see a lot of the same restrictions that we see in Pennsylvania. So insurance offered on the state healthcare exchange, and the state healthcare exchange was established under the Affordable Care Act, restricts the coverage of abortion, and state Medicaid funding in Ohio cannot be used for abortion services outside of narrow exceptions, such as cases of life endangerment, rape, or incest. And abortion is also banned around 6 weeks in Ohio. And if you are seeking abortion care as a minor, you need parental consent. And a patient must wait 24 hours between receiving state mandated abortion counseling and obtaining an abortion. Does that answer your question, Rachel? Okay. I am going to move on to the next slide. And it's just as important to know about the landscape of your state as it is to understand the different types of bans and restrictions on abortion access. So as you're going to college, or as you are supporting someone who is in school in a different state, it's important to figure out what types of policies are in place in that state. So we'll talk about bans. There are pre-Roe bans, and most states repealed abortion bans as of 1973, once Roe made them unenforceable. However, there are some states and territories that never repealed their pre-Roe abortion bans. And so once the Supreme Court case, once the Dobbs versus Jehu case overturned Roe, these states can have and are trying to revive these bans. There are trigger bans, which are bans that have been passed since Roe that immediately went into effect following the Supreme Court decision. And these bans were and are intended to ban abortion entirely when the Supreme Court limited and overturned Roe. Or they are also designed to go into effect if there is ever a federal constitutional amendment prohibiting abortion. There are also what we call pre-viability gestational bans, and these are laws that prohibit abortion before viability at 24 weeks. And these laws are unconstitutional under Roe, or were unconstitutional under Roe. And just for your awareness, gestational age is counted in weeks, either from the last menstrual cycle or from fertilization. There are method bans that prohibit a specific method of abortion care, most commonly dilation and extraction procedures, and also dilation and evacuation procedures. There are reason bans, which are laws that prohibit abortion if sought or potentially sought for a particular reason. And these bans include sex, race, and genetic anomalies as prohibited reasons. But there is no evidence that pregnant people are seeking abortion care because of the sex or race of their fetus. Some states are also criminalizing self-managed abortions or people who end their pregnancies outside of a healthcare setting. And there are also SB 8 copycat laws, which are laws that have been modeled after Texas SB 8, which is the vigilante law that took effect in September 2021. And these laws ban abortion at early gestational ages and are enforced through private rights of action, which would authorize a member of the public to sue an abortion provider and people who help others access abortion. And in addition to bans, there are other types of abortion restrictions. These include trap laws or targeted regulation of abortion providers. These single out physicians who provide abortion care and impose various legal requirements that are different from and more burdensome than those imposed on physicians who provide comparable types of care. They don't improve patient safety and are usually, are counter to evidence-based clinical guidelines. So trap laws fall into several categories, including regulation of locations where abortion is provided, facility specifications, provider qualifications, and reporting requirements. Compliance with these laws is often very costly and can require unnecessary and also prohibitive facility modifications. And there's also parental involvement laws that require providers or clinics to notify parents or legal guardians when minors seek abortions prior to an abortion, or laws that require that providers document legal guardians' consent to a minor's abortion. And then there are consent laws that require pregnant people to receive biased and often inaccurate counseling or an ultrasound prior to receiving abortion care. And in some instances, like we saw in Ohio and Pennsylvania, to wait a specified amount of time between the counseling and or ultrasound and abortion care. So these laws serve no medical purpose, but instead they seek to dissuade pregnant people from exercising bodily autonomy. So states may have one, none, or a combination of these policy options, but understanding the policies that each state has in place is the best way that you can educate yourself and ensure access and understand what your options are when attending school out of state or supporting someone who is attending school out of state. All right, thank you, Tyler. I think we can go to the next slide and I will turn things over to Madison to discuss health considerations.
Awesome, thank you. Before I jump into that, I was able to pull up the DC information while you were talking, so I can answer Teresa's question. Abortion is currently protected in DC. There are no bans or restrictions in place right now, and they actually have a clinic safety and access law that provides additional protections to that area. There is a possibility of concern due to the district's unique legal status. The Congress could attempt to prohibit or severely restrict abortion in this district, but that is not currently in place, and that's not currently something that they are pursuing right now. Like Madeline said, we will share the link to the Center for Reproductive Rights where you can check out all the areas on there as well. So now diving into some health considerations. So since we better understand the landscape, let's start talking about what to actually do health-wise. So next slide, please, Tyler. So let's start with the preparation step. What should you do before you actually leave? And this is assuming that you are currently living in New York or another state that has access to abortion care. So it is really important to make an appointment with your doctors, all of your doctors, including your gynecologist, before you leave for school, and schedule the appointments for when you're home from break. Sometimes it can be really hard to get an appointment, so planning ahead is really important. During those appointments, it is a great time to talk to your doctor about birth control options and making sure to have access to that birth control regularly. This can look like, if you choose an option like the birth control pill, making sure you get a supply to last you at least until you come home from break, and that you can bring with you. Or exploring options like long-acting birth control methods, which includes IUDs and other devices that do not require ongoing action, like picking up a prescription or renewing it. This is important to determine what option is best for you with your doctor, and keep in mind that accessing birth control may also be difficult in states that have restricted abortion access. It is also really important to bring various barrier methods and emergency contraception with you. While we know that emergency contraception is not an abortion, many states are looking to regulate this option as well. If you do bring an emergency contraception option with you, a few things to keep in mind is to fly with it instead of mailing it, because we do know that some states are trying to regulate the shipping of this pill. And consider the different emergency contraception options, because some do not work over a certain weight. So that's another great thing to talk to your doctor about. It is important to figure out what is best for you and your body. And finally, bringing one or two options is a great idea, but please keep in mind of not purchasing large quantities, because this is a time-sensitive process and we need to make sure that the supply is available in communities when needed. Bringing and mailing barrier methods is also a great idea. And it's good to be mindful, if packing, of keeping them away from sharp objects. I always joke that the first thing that we learn when we come here is not to put the pins and the condoms in the same bag. So keep them away from sharp objects, making sure that they're not stored in extremely hot areas, and always check your expiration dates. Planned Parenthood Hudson Peconic is offering to mail safer sex kits to anyone who wants or needs them, and we'll share the link at the end. So whether you are in our area or not, you are still welcome to fill out that form and send a safer sex kit to a loved one in your life. Next slide, please. So if you do find yourself in a state with abortion restrictions and in need of care, there are a few important things to consider. First, look for contacts at abortion funds if needed. Abortion funds are an incredible resource available in each state, and sometimes even more locally. Become familiar with both the abortion fund in your new state as well as your home state. If you need to travel home, one or maybe even both abortion funds can support you as needed. You do not need to be a resident of the state, currently or formerly, to get that support. Traveling can be really expensive, so this support can be really beneficial. Even if you are in a state with a complete ban, reach out to your local Planned Parenthood. Some states have partnerships with surrounding states to help you get an appointment as needed. And even if they don't have that, they have great resources they can connect you with to help you get the care that you need. And finally, it is really important to do your research before making an appointment and keeping a lookout for crisis pregnancy centers, or sometimes known as CPCs. CPCs are clinics or mobile vans that look like real health centers, but they have a shady, harmful agenda to scare, shame, or pressure people out of getting an abortion. They might have ultrasound machines, staff in white coats, medical sounding names, and professional websites, but many tell lies about abortion, birth control, and sexual health. While CPCs exist everywhere, they are often more prevalent in abortion restricted states, and many of these states have gestational age or method bans that we just learned about that put a shorter timeline on someone's options for care. Time is of the essence, and a delay due to a crisis pregnancy center can be detrimental for many. So some of the ways you can tell if it is a crisis pregnancy center are if it's listed online or on map apps as a pregnancy resource center, pregnancy help center, pregnancy care center, women's resource center, or abortion alternatives. Sometimes they advertise free pregnancy tests, abortion counseling, pre-abortion screenings, abortion education, post-abortion care, or after-abortion help, but they refuse to help you get an abortion. They advertise the abortion pill reversal, or say you can reverse an abortion. This is not true. You can't reverse an abortion procedure. They say abortion is unsafe, or that it leads to cancer, infertility, or mental health problems. This again is untrue. Abortion is one of the safest medical procedures. The rate of major complications is less than 1%, and it's safer than getting your wisdom teeth taken out. Abortion also doesn't increase your risk of cancer, infertility, or mental health problems. They will also often say negative things about abortion, birth control, condoms, or sex. They don't provide condoms or other effective birth control methods like the pill, patch, ring, shot, IUD, or implant. If they do offer birth control services, it's usually only the fertility awareness method. A lot of times they will try to pressure you into continuing a pregnancy, sometimes giving you baby clothes or small fetus dolls. And they try to talk about religion even when you don't want to. Finally, they will often say things, judgmental things about sex before marriage or the LGBTQ+ community. So it's important to keep an eye out on these red flags when you're looking for a place to access abortion or general family planning services. Next slide, please. So we also want to briefly touch on a newer public health emergency that we expect to see coming up more in the weeks to come. So the HMPXV virus, or as you all probably know, monkeypox, has been designated as a public health emergency. It is a rare virus that presents itself as a rash or multiple rashes and skin lesions. It may also be accompanied by flu-like symptoms such as a fever, swollen lymph nodes, sore throat, headache, muscle pain, and or fatigue. This disease is spread through direct, prolonged skin-to-skin contact with a person carrying the virus. It is also spread through droplets if within 6 feet of someone with monkeypox for 3 hours or more. So if you are eligible, you can receive a 2-dose monkeypox vaccine from the Department of Health, or Planned Parenthood Hudson Peconic is also providing it. Is Central Western at this time? We will get you all the information of getting that vaccine as well. Awesome. So refrain from physical contact until they begin to test negative. So if a friend or a partner has tested positive, again, refrain from physical contact until they begin to test negative. It's important to know anyone can get monkeypox. Despite the common misconception, anyone of any gender or sexuality can contract monkeypox. So if you suspect you may have it, get tested in order to keep your community safe. Next slide, please. And I am turning it over to Sarah.
Right, so we talked about how to prepare health-wise for a move to a different state for college. So now we're going to talk about the more exciting part of getting involved in advocacy in your new community. Next slide, please. So, how to get involved in abortion, access, advocacy, volunteering in your new community. Number one, of course, look for your local Planned Parenthood for volunteer opportunities or advocacy opportunities. Every affiliate is very different in terms of what volunteer roles they have available or what their needs are. So it's best to reach out to them directly to see what they're in need of, or follow them on social media and see what they have going on, sign up for their email alerts, all of that good stuff. Another option with Planned Parenthood is to become a national Planned Parenthood volunteer. They have virtual volunteer shifts that you can sign up for. So that's another option with Planned Parenthood. And since you'll be on a college campus, you can also get involved in your local PPGen groups on college campuses. PPGen stands for Planned Parenthood Generation. And Planned Parenthood Generation chapters work with their local Planned Parenthood affiliates to organize events, outreach, and advocacy on their campuses and in their local communities. And if there's not a chapter already on your new college campus, you can start one. So you just have to reach out to the local Planned Parenthood affiliate and ask about how to go about doing that. Another great way to support your local community and abortion access in your community is to fundraise to support your local abortion fund. And there are so many different fun and creative ways of doing these fundraisers. So I think it's a really great thing to think about on a college campus. Finally, make sure you're registered to vote in your new state and have a game plan to do so. As a college student, you can vote via an absentee ballot or in your new state of residence. So the key is to look these things up and have a game plan in place. Okay, next slide. We're going to close out with resources to a lot of the things that we talked about. Go to the next slide. First, we have a link to the Planned Parenthood, the national website. They have, of course, a million great resources on there. Next, Abortion Finder. They are an amazing resource to find trustworthy, verified abortion providers across the country. Wherever you are, you can punch in your zip code and see what your options are, whether in-person, medication abortion. It is a great resource because they only show verified abortion providers. Whereas if you just go to Google and type in abortion near me, you will probably get some crisis pregnancy centers popping up in your Google search. As we talked about, we want to avoid those. So using Abortion Finder is a great option. The New York Abortion Access Fund, that is our statewide abortion access fund. And you can utilize that living in New York State or in a different state. If you are from New York, but you moved to a different state for college, you can also utilize the New York Abortion Access Fund for resources. Expose Fake Clinics is an organization that helps identify and report crisis pregnancy centers so that we can, spread public awareness and make sure that people who are in need of an abortion aren't being misled and denied care, delayed care because they're going to a fake clinic. The National Network of Abortion Funds, another great resource. They are like an umbrella for all of the abortion funds across the country. So also a great resource. Next, the Center for Reproductive Rights. That's the link you'll go to if you want to view the maps we were looking at earlier. They have just a ton of great information about the different policies that are in place across the country. So also great. Factor It In. This one was actually new to me and definitely recommend if you are a college student to check it out. It's an organization that empowers students to be active agents of change to secure reproductive freedom in every state. So a great resources for college students specifically. The next link is to the PPHP See First Sex Kits that Madison talked about. So whether you are local to, Hudson Peconic, or if you're from Central Western New York or another region of New York, you can also utilize that resource, which is really awesome. So definitely encourage you to check that out and spread the word about that. And there's a link to the Planned Parenthood National Virtual Volunteer Team that I mentioned. And finally, if you have any specific questions or you need help figuring something out, you can always reach out to us directly. And there's Madison's email there, and also Maddie and I. So I think that's it for resources, and we can move on to the next slide for questions. Feel free to pop any questions in the chat or unmute yourself and ask them, and we'll do our